Oh, well, so let me talk a little bit about how Bellafill fits in with all the surgical procedures that I perform. So I'm a facial plastic surgeon, which means I do a lot of facial cosmetic surgery naturally, which includes brow lifts, eyelid lifts, facelifts. Those surgical procedures are very effective, but they also have their limitations, meaning that there are plenty of patients who come in where we want to improve the contour of their neck, we want to improve the jowls, and we can do that very effectively with a facelift. That's exactly what a facelift addresses. But if that patient has had a lot of volume loss in their face, which is expected, that's part of the aging process as well, then as great of a facelift as I can do for this area, they're still going to look like they've aged in the mid-face. That's where things like Bellafill and fillers come in. I specifically like to use Bellafill when I'm doing a facelift because those patients are expecting long-term results. They're not here for a 6-month or 12-month result. They want many years benefit out of whatever rejuvenation procedure I'm performing at the time. So I love the combination of rejuvenating this area with my surgical procedure and then non-surgically rejuvenating the mid-face area. So that's a perfect example of how using two different techniques can really provide a lot of synergy and get a much better natural looking result for a patient.